Introducing Good Health, sponsored by Wolfson Children's. Hope starts here.
Today, we're talking about childhood epilepsy, and with us today is Dr. Fernando Galan and Dr. Alexandra Beier. Thanks for joining us.
Hi there.
Hi, how are you?
I'm doing well, and I know a lot of people want to hear about some treatment options, but before we get into that, Dr. Galan, can you tell us how common this is?
Yeah, so epilepsy is actually one of the more common things we see in our clinic, particularly in childhood. Actually, epilepsy is more common in kids than adults. About 1% of all kids will have epilepsy, and that's more common in younger age groups. I know one of your specific questions is how common are seizures in babies? And if you take kids less than 30 days old, about 2 to 3 per 1,000 babies will have seizures. Definitely one of the more common things we see at Wolfson.
Yeah, and that's unfortunate to hear. But Dr. Beier, what actually causes this?
So there are lots of different causes. There's what many parents may have experienced is a febrile seizure where a child typically under the age of 2 has a high fever and they have a seizure associated with that. But some of the more other causes that go along with it are congenital reasons. So for some reason, the brain didn't develop properly and there's an abnormality in the brain where the cells don't go to the right spot and that irritates the brain to cause seizures. We also see it with tumors. We also see it with head trauma or any sort of injury they may have had even in utero. So there's a variety of causes and not all of them need a surgical intervention, but some of them do.
Dr. Galan, you mentioned about babies having seizures, less than 30 days. How does that present? Like, what can parents be looking out for?
Yeah, so oftentimes babies, particularly less than 6 months of age, can have seizures that are a little bit more bizarre or strange. They're not like the typical convulsive seizures that you might see in older people. They may range from things like apnea, so pauses in breathing with stiffening, to what we call focal motor seizures of one half of the body, where maybe only one arm or even an arm and a leg together are moving rhythmically. You can have things like repetitive jerks or full body tonic stiffening. So there's a wide range of seizure types that can occur. And oftentimes we actually ask parents to take cell phone video to kind of better clarify what the spell in question is, so that we can give parents a better idea of what they're seeing at home.
All right, let's say they are seeing something like this, something disturbing that they do not want to see in their child. Dr. Beier, what are some of the treatment options?
Right. So I think, as Dr. Galan mentioned, the first thing is diagnosing truly what they have as an actual seizure. And then we're very fortunate that in Jacksonville, we're able to offer a wide variety of treatment options from starting from medications, but also to the more significant things where I get involved with regards to surgery. And we are able to offer the wide variety of surgical procedures to treat and hopefully cure epilepsy.
And Dr. Galan, what is your message to parents who think that they may be dealing with a child who has epilepsy and maybe hasn't been diagnosed yet?
Yeah, I think, our message is that sometimes it can be a difficult road, and it can be something that you need a lot of support for diagnosis for. And we're here to help the community. We have all that we need at Wolfson's to diagnose and properly manage epilepsy. We have specialists from Nemours and UF Jacksonville that all work together at Wolfson to provide the best care we can, and make the best decision for families and help people stop having seizures.
Yeah. So let's say a family wants to get in touch. What's the best way, Dr. Beier?
Yeah, the best way is actually going to the website. So go to www.wolfsonschildrens.com/neuro, and there'll be contact information for both neurology as well as neurosurgery, and also a lot of information to kind of help guide parents as they're dealing with this diagnosis.
All right. Thank you both so much for joining us today to get this important information out.
Thank you so much for having us.
Thank you for having me.
Of course. And if you'd like to see this segment again, just head on over to firstcoastliving.net.